Hey everyone, I just want to do like a part 2 series regarding like chest pain and in triage. So kind of like going over what we did in part 1 and extending it a little bit more. So regarding chest pain, it's also really important not to just really think of a heart attack, even though that's our main priority, but also like PEs, pneumonias. So that's why in our facility that where I work at, they have this chest X-ray, and then they have CBC, CMP, troponin, and the EKG. And that chest X-ray can definitely help to see if they have a pneumonia going on in there. The PE, it's definitely going to be seen in more in the CT scan of the chest with contrast. But normally, you just want to have a head start with any of these things because they could be having this chest pain and have pneumonia at the end of the day. So we always want to rule out like the worst things that can happen to a patient. So it's really important for you to address the reasons why they're going to be having these tests. So, like I said, in the facility where I work at, I normally explain why CBC, why CMP, why troponin, why chest X-ray, why EKG. And for you, well, just to say to you guys, EKG, just to rule out if they're having like an actual MI, like with ST elevations noted. Troponin, when the heart gets fatigued, it normally releases this troponin markers into the bloodstream, letting us know like the heart is getting tired, it's getting fatigued. So it could be a sign of an MI. It could be science, right? There could be other reasons why the troponin might be elevated, which will be for another video. But yeah, so that's that. And then chest X-ray, just to rule out like if there's any pneumonia going on there, any anything abnormal in the lungs, which can hopefully explain the chest pain. CBC, CMP, just to know that you're having an infection, check your electrolytes and all that good stuff to see like if there's anything wrong with them. Obviously, potassium is a really huge one for like arrhythmias and stuff like that. So, and also sodium is crucial, calcium as well. But yeah, so those will be mainly the things, and really important for you to just not focus on the chest. Also, any swelling on the legs, and do you get fatigue when you're walking, like any shortness of breath? That's really important. Because if they do have shortness of breath, we can be thinking of like congestive heart failure. We could be thinking like a pulmonary embolism. We could be thinking of pneumonia. Anyone sick at home as well. That's definitely like important factors. Because if they do tell you like, oh yeah, there's like my wife is coughing at home, blah blah, then you can be thinking more towards that aspect, like pneumonia, stuff like that. Any recent troubles? Do you take blood thinners? Did you stop taking them? Sometimes you'll be surprised, like they will tell you like, yeah, I'm on Eliquis, but given that I don't know, it makes my stomach upset, I stopped taking them like 5-7 days ago. So that's kind of like another red flag for you, right? Because if they could be developing a blood clot, and it could be causing a PE for them. Obviously these are things that we would normally see in the ER, and it's really important to be kind of like focus on your assessment in the chest, but also other things that can be causing this chest pain. All right. Well, thank you so much, guys, for watching. I'll see you guys into the next video. Bye bye.